After the age of 50, many people begin to quietly notice certain changes in their health. During the day, we can still move around normally, but when night falls, unusual signs begin to appear. That is when the joints begin to make themselves heard. Persistent, dull knee pain that lingers late into the night. Your shoulders may feel heavy, as if something is pressing down on them, making movement more difficult. In the lower back, it becomes difficult to find a comfortable position that allows you to fall into a restful sleep. What has made me reflect the most, over more than 30 years of medical practice, is not the pain itself. It is the way we accept it as an inevitable part of aging without seeking proper treatment. Many people have told me that at this age, the body is simply expected to endure such aches and pains. However, modern medical science shows something quite different from what we commonly believe. Most joint pain that appears after the age of 50 is not because your joints are completely damaged. It is because a silent inflammatory process has been continuing for many years without us even noticing it. Inflammation does not always present itself dramatically. Sometimes it is just mild stiffness in the early morning. Or it may be a restless night when your knees feel unsettled and uncomfortable for no clear reason. The key point is that our bodies still have the ability to regulate this condition if given the proper support. Today I want to talk to you about a very familiar leaf. Small, inexpensive, yet incredibly valuable. It is often overlooked in daily meals, yet in medicine, it contains remarkable active compounds. These compounds are capable of soothing the body's inflammatory responses in a completely natural and safe way. It is the humble Perilla leaf, and what I'm about to share is not merely a piece of folk wisdom. Rather, it reflects how our bodies respond to it at a biological level, as clearly demonstrated by scientific research. When we are young, the body processes inflammatory reactions very quickly, thanks to strong circulation and a healthy immune system. But after the age of 50, blood circulation slows down, muscle mass gradually decreases, and inflammatory reactions are no longer fully resolved. They do not cause major swelling or send you to the hospital immediately, but they persist at a low, smoldering level every day. In medicine, we call this persistent low-grade inflammation, the silent enemy of the joints. This condition gradually thins the cartilage layer over time, making the joints feel stiffer each morning. It also makes pain more likely to appear at night, when circulation in the body is at its slowest. The important thing is that the body still has mechanisms to regulate inflammation, provided we give it the right support. Perilla leaf becomes especially interesting because it contains a unique compound called luteolin, a valuable flavonoid. Research shows that luteolin helps calm the overactive inflammatory signals within the body's system. I want to emphasize that this is not a fast-acting painkiller. It does not eliminate pain instantly. Instead, it supports the body in reducing the intensity of inflammatory responses in a natural, sustainable, and gentle way. In addition to luteolin, Perilla also contains rosmarinic acid, a powerful antioxidant that helps protect cartilage cells. It protects cartilage from damage caused by free radicals, something people over 50 especially need. After the age of 50, the body's natural antioxidant capacity declines, making dietary support increasingly important. When inflammatory responses are calmed, circulation to the joints improves, and you may notice your joints feel significantly lighter. Your sleep may also improve, as reduced inflammation helps stabilize nighttime cortisol levels. Perilla also has a gentle effect on the nervous system, helping the body relax without causing forced drowsiness. Many of my patients over 60 have maintained the habit of using Perilla, and found their joints more comfortable. So how should you use Perilla for the best results? I always advise my patients to make it a consistent habit. You do not need high doses or daily use. 2 to 3 times a week is sufficient. The simplest way is a warm bowl of Perilla soup at an early dinner, cooked with minced meat or fresh fish. What truly matters is not a complicated recipe, but the warmth and consistent practice. If you prefer tea, steep a handful of fresh or dried leaves in hot water for about 5 to 7 minutes. Drink it while it is still warm, about 1 to 2 hours before bedtime for optimal absorption. Do not brew it too strong or drink too much. A small, moderate cup is sufficient to gain the benefits. After 50, the body responds better to stability rather than sudden, drastic changes. However, there are a few precautions. If you have low blood pressure, use it in moderation and monitor your body's response. If you have a sensitive stomach, avoid drinking Perilla tea on an empty stomach to prevent unnecessary irritation. I do not recommend using it continuously for months. Rotate different foods, as the body thrives on variety. Perilla is only a supportive element. Gentle movement, keeping the joints warm, and sleeping on time remain the core foundations. We do not need complicated methods. We need simple practices that we can sustain over time. Painful joints do not mean the body has lost its ability to recover. Sometimes they are simply reminding us. They remind us that it is time to return to the most basic essentials, such as proper nutrition and rest. Eat regularly, keep your body warm, get enough sleep, and always listen to the subtle signals from within. Perilla leaf is not a miracle cure, but it serves as a gentle support for the joints. It helps the body do what it already knows how to do, with just a little extra support. If you are over 50 and feel your joints becoming heavier, try starting with this small change. Sometimes, what makes the greatest difference is not the strongest action, but the one you maintain the longest. I am Dr. Samuel, and I am always here to share the most practical ways to care for your health. Stay calm and listen to your body, for your health is your most precious gift. Wishing you good health and restful nights with your family. I look forward to seeing you again in our next discussion.